What are the symptoms of coronavirus? Some people have no symptoms. Those people would be asymptomatic. They don't show signs of having the symptoms, but they are carriers of the virus. If they do have symptoms, they could show up within 2 to 14 days after exposure. That is why there is a 14-day quarantine. The symptoms are most likely to be similar to that of the cold, the flu, or seasonal allergies. One could experience a fever, headache, fatigue, sore throat, or runny nose. Coughing and shortness of breath are common according to the CDC. The older you are, the more likely you are to get exposed. Typically, older folks have severe forms of the symptoms. Should you have a case of the coronavirus, you may experience gastrointestinal symptoms such as diarrhea, chills, shaking, or muscle pain. Symptoms can also include loss of taste or smell. In more extreme cases, people with underlying health conditions like heart disease or diabetes develop pneumonia, frequent or high fevers, persistent cough, and signs of respiratory distress, like shortness of breath and chest pains. A small percentage of cases progress to acute respiratory distress, difficult breathing, chest pains, and pressure, confusion, and extreme fatigue. Should you have any of these symptoms, it's time to contact a healthcare provider. With mild symptoms, it is a good idea to call your PCP first. Look for emergency warning signs for COVID-19. If someone is showing any of the signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. What is the difference between influenza, flu, and COVID-19? The flu and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by an infection with a new coronavirus called SARS-CoV-2, and flu is caused by infection with the influenza virus. COVID-19 seems to spread more easily than flu and causes more serious illnesses in some people. It can also take longer before people show symptoms, and people can be contagious for longer. Because some of the symptoms of flu and COVID-19 are similar, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. While more is learned every day about COVID-19 and the virus that causes it, there is still a lot that needs to be learned. This is Chris Marshall. Good night and good news, and stay safe.